Assalamu alaikum. So in this video, we'll be talking about the neurosurgical anatomy of the hypoglossal nerve. This is a series of videos. We're going through the Rotem collection for the neurosurgical dissections. Please make sure to look at the previous videos within this series through the playlist on the channel. Also, there are a variety of other videos on the channel. So we'll start with this anatomical picture that we have seen in previous videos. Make sure to have a look on those. So you can see the hypoglossal nerve is highlighted here, and it emerges from the anterolateral sulcus of the medulla anterior to the olive, which the inferior olive basically separates it from the other cranial nerves, the lower cranial nerves. You can see here again the hypoglossal nerve is kind of a little one, and on this left side it's kind of duplicated nerve. Here, a familiar picture that we have seen in previous videos. Again, this is the floor of the first ventricle, and you can see here this is the hypoglossal triangle, which lies medial to the vagal triangle. Then here again a very familiar picture about the base of the skull. So this is the skull. You can see here the bilateral occipital condyles, and the hypoglossal canal should be going through the occipital condyle. Here, after it passes through the occipital condyle, here, the hypoglossal canal, within the hypoglossal canal, the hypoglossal nerve joins the other lower cranial nerves as they come out from the jugular foramen. So the only one that goes through the hypoglossal canal is the hypoglossal nerve. We will see other pictures later on that will show that in much more detail. Here is again a nice view, which is kind of going from looking at the inferior part of the skull, but also looking from one side. You can see the occipital condyle here on one side. This is the occipital condyle on the other side, and this is kind of the hypoglossal canal from the inside, and here is the foramen. Here is you can see the hypoglossal nerve as it emerging from the hypoglossal canal just anterior to the jugular foramen. And in this picture we're looking at the lower part of the clivus, and here is the occipital condyle, and we can see that the hypoglossal nerve here is just emerging from the hypoglossal canal. And then we see the rest of the lower cranial nerves. You can see the vagus nerve, the hypoglossal, the glossopharyngeal nerve, as they are exiting through the jugular foramen. And then here is again a similar view, but it's an endoscopic view. You can see the hypoglossal nerve coming out of the hypoglossal canal, while the rest of the cranial nerves, you have number 9, number 10, number 11, all are coming out through the jugular foramen. Then with this view, again, the lower portion of the clivus has been removed so that we can see this picture. You can't see that without taking the lower part of the clivus. So we can see number 9 is highlighted here. We can see number 10, number 11, and then finally you can see the hypoglossal nerve as it's coming out from the brainstem and within the hypoglossal canal. This is a transcondylar approach. So you have to do, it's kind of a far lateral approach. So we're looking posteriorly. Those are the neck muscles from posteriorly. I believe that should be the C1 lateral mass, and the muscles are reflected inferiorly so that you can see this area here, and this is the vertebral artery, and here you can see the occipital condyle, which basically covering the nerve. Here again is a similar view, but all the bone has been taken out with partial removal of the occipital condyle, and you can see the hypoglossal nerve is highlighted, and as it enters into the hypoglossal canal, which is the hypoglossal canal is the anterior limit of what you can do for a condylar resection. And posteriorly, you can see the spinal accessory and the vagus nerves. In this picture is highlighting the hypoglossal canal and the jugular foramen. So you can see the duplicated hypoglossal nerve here, which enters into the hypoglossal canal below the jugular foramen, where you can see the rest of the cranial nerves are coming out through this foramen. Again, just to emphasize on this point, you can see the hypoglossal nerve duplicated, and then which is coming out of the canal, but the others are coming through the jugular foramen. So you can see the glossopharyngeal, the vagus, and the spinal accessory nerves. This is an extracranial course, and you can see the hypoglossal nerve is just highlighted here, and it's medial to the internal carotid artery, internal jugular vein here, and lateral to the internal carotid artery. So hypoglossal, internal jugular vein, and the internal carotid artery. This is a view laterally, and you can see the hypoglossal nerve as it comes out. Then it goes in front of the lateral to the carotid artery, and then goes towards the inferior to the posterior belly of the digastric muscle. Then after it goes, as we said, through the hypoglossal canal, it curves anteriorly to lateral to the internal carotid artery. And then once it goes towards the tongue to supply the tongue as we know. I hope you enjoyed this video. Please like, share, and subscribe our channel. You can also follow us in other social platforms on Instagram, on Facebook, and on Twitter, where we share multiple other educational content in the form of tutorials and infographics. We would love also to see you collaborating with us, and stay tuned for the next videos and the next updates about our digital education projects.